Tennis elbow, also known as lateral epicondylosis, is a very common problem which can be quite a nuisance given we use our arms so much. This may even limit recreational activities or work. The thought is that the muscle tendon can become weak over time, then acutely or chronically overloaded, resulting in micro and macroscopic tearing. This will often recover with appropriate conservative management, but sometimes will be more stubborn and develop into a chronic condition. Conservative management includes rest, heat, medication, topical medications, including magnesium. Physical therapy is one of the most important treatment options for this, specifically eccentric strengthening of the wrist extensors. After exhausting all these options, if there's still little relief, patients often seek out medical advice with a sports medicine physician or pain management physician. One common treatment is corticosteroid injections. Whatever you do, don't let your doc do this. Even with evidence showing no long-term benefit and possible detrimental effects to the cells and tissues from the steroids, this is still commonly performed. One option to keep you away from the surgeon is using a platelet rich plasma injection. There's been many studies showing the benefit with platelet rich plasma injections, both in the intermediate and long term. Typically, we don't see the improvement right away, and it takes a bit of time for the benefit to demonstrate. PRP is definitely not a magic bullet, but it's a nice alternative to corticosteroids as we're trying to facilitate or optimize the healing response to the damaged tendon. This is still paired with strict home exercises or home physical therapy. Feel free to check out our website for more information. Until next time.